I'm now pleased to announce our next speaker, Courtney Dunphy, and her talk, Being a Patient. Courtney is a third-year medical student and a Colgate University alum with a degree in cellular neuroscience. After graduation, she took 2 gap years, during which she spent 3 months working as a one-on-one patient sitter in a nursing home in Colorado. She then moved back home to New Jersey, where she worked as a medical scribe in a neurosurgery office while nannying and waitressing on the side. At Robert Wood, she has served as a co-president for the Neurology Interest Group and was a member of the Caring Companions Group, providing social interactions to the elderly isolated at home during COVID. When she's not at the hospital, you can find her listening to music, skiing, and spending time with family and friends. Please welcome Courtney Dunphy.
Have you ever heard the phrase, doctors make the worst patients? That's false. Medical students. Medical students make the worst patients, and I can tell you that from experience. I was a terrible patient. At every complication, I asked a billion questions, and I still had the audacity to ask every single day when I could go home. It all started this past March at the end of my M2 year, when, as any good medical student does, I ignored my pain for a week. After one jarring night spent on the bathroom floor, I decided it was finally time to go to urgent care. Not the emergency room, but I would settle for urgent care. I showed up before they even opened, pacing outside in so much pain, and they opened to let the crazy girl in. We were at the end of our M2 clerkship, so we were in our GI block. Because we were in GI and learning about all the associated GI disorders, I was convinced I had appendicitis. I explained that to the doctor that I saw, and he looked at me and says, 1, you don't have appendicitis, and 2, get someone to drive you to the ER. I know how the ER works, so as soon as we got there, I knew I had to get ready to play the game. Okay, you have to go in and tell the essentially receptionist all of your symptoms in half a sentence. And that determines everything. That determines how long you sit there waiting. Okay, so what is my most concerning symptom? Fever? That could be a bad cold. Flank pain? Pyelonephritis from a UTI? You can wait. Abdominal pain and vomiting? That's my ticket in. That could be an emergency. I got back quickly because I played the game. I had a pregnancy test, blood test, urine test, an abdominal ultrasound, and abdominal CT. And then I found myself alone in the bowels of the hospital in some basement corner hallway, convinced that the transport had lost me. I texted all my friends that they forgot about me, and that was not the first time that I thought the hospital had forgotten about me. Because I'm a medical student and the ER doctor knew that, I was privy to a world that most other patients don't know. The ER doctor called me over, and I hustled over there in my sweatpants. He called me up behind him as we scrolled through my CT scan, and he showed me my kidney stone. Now, every time I say I had kidney stones, the people that hear me say that say, oh, well, my uncle, my coworker, my dog had kidney stones. It's not a competition, but mine wins. I had an obstructed kidney stone, meaning it was blocking the entire ureter, the tube from the kidney to the bladder. That obstruction caused an infection of my kidney, which caused an infection of my blood. I'm in the ER, I have this blood infection, and suddenly my temperature is going higher and higher. It seems like it was hours, but it seemed like not that long until I'm consenting to surgery with the urology resident. At first, it was okay, we have to do surgery. Maybe today, maybe tomorrow, we'll see what the OR looks like. Then it became, okay, well, if the OR is not available, we'll do it either in the OR or in the procedure room. My temperature kept rising. Then he was like, okay, yeah, we won't wait for transport. I'll bring you down myself. For some reason, the urology resident's inability to steer the bed really comforted me. You can't be good at everything, so hopefully that meant he was a good surgeon. I forgot I added this part. So I'm in the OR. This is just for all the medical students. It has nothing really to do with the talk. But so I'm in the OR, and the anesthesiologist is teaching me. He's telling me about what everything is. And they had a gas mask over my nose and mouth, about to put me to sleep. And he goes, hold this. I was like, okay. And he's like, not you. You're supposed to be the patient. I'm like, okay, I'd rather not be, but okay. So after surgery, I'm half asleep, and I could hear the bustling around me. My temperature's really high. I'm shaking off the table, and I could hear the nurses say, "Oh, her temperature's 105, 106." And there's some little person in the corner "No, if it was that high, she'd be dead." I'm sitting there oh. Some people, when they're that sick, they have out-of-body experiences. They find religion. They discover the meaning of life. All I was thinking was, shit, I must be sick. They got my temperature to go down a bit, but next was my blood pressure. They kept running the cups on either arm, and the machine would give out a wimpy little sound every time it didn't get a read. My blood pressure was so low that everyone started to get nervous, and every time they ran the blood pressure cuffs, a new person would walk into the room. There were so many people in the room that there was a resident pacing back and forth. There was 2 nurses on either side and multiple blood pressure machines. But I will tell you that even with all of that going on, it wasn't even a thought that someone would take a manual blood pressure. So if you're like me and struggled to learn how to take a manual blood pressure, don't worry about it. Apparently, you don't need it. After getting my blood pressure up, well, they didn't actually. That's when we get to that. They tried to get my blood pressure up with fluids. I had an IV in both arms from the nurses. They decided that the fluids weren't working and I needed to go to the ICU to be put on pressors. So my poor resident, who was just, I was sweating because I had a fever, but he was sweating more. He was I think he was the first year and he was scared. He's fighting with the nurses, then he calls a rapid response. And I've heard a rapid response in the hospital for a patient. And I kind of thought it would be more of a big deal. They just yelled it out over not yelled it out. The loudspeaker went off with the rapid response on 5 North. And then someone later comes walking in. It's yes, we accept you to the ICU. They brought me to the ICU, put me on pressors. And when you're in the ICU, you don't realize you have any sort of dignity you have is lost. I couldn't even lift up my arms to braid my hair, so I had a nurse braiding my hair. They changed my gown from the soaking wet gown I was in, and I lost any semblance of dignity, so I will show you photos. And I will tell you, this is when I was feeling better. This is days in. I got food for the first time. I'm wearing a nasal cannula because I had to have high flow oxygen because, again, I was a bad patient. They gave me so much fluid that I had acute respiratory failure from pulmonary edema, meaning it was very difficult to breathe. I had very good friends that brought me animals. After about 5 days, I was downgraded to the floors, and I had the opportunity to walk around. My doctor wanted to test my lungs as I moved around. So she hooked me up to a pulse ox, and I was free to move around the unit. It was a little bit too much freedom in terms of I was looking at every exit, being maybe I could leave. But I was supervised, and a friend and my sister came and walked me down. And then just as the doctor was testing my oxygen levels, I tested them when I was reporting the results. Doctor asked me how it was. I said, "Oh yeah, it was 92 the whole time." Looked over at them suspiciously, not mentioning the one blip it went down to 82% oxygen. They didn't snitch. They passed my test. My story doesn't end there. Otherwise, I wouldn't be up here. I had every complication. I was in the ICU for 4 days that time, but then I was in the hospital for a total of 24 days over multiple admissions with multiple surgeries. So to give you some context, my stone was originally treated with radioablation, which is the normal treatment for a stone. Then I thought that I was done. I thought this whole thing would be over. I would never talk about it at something like this. And I took my GI final and I went to Montana to ski and to study, in that order, and get ready for step 1. As I'm there, because my stone was impacted, it formed a stricture. And that stricture caused an obstruction and I had sepsis again. This time I'm in the mountains. I had to be transferred down through a blizzard to the bigger hospital where they treated me for sepsis again and put in a stent again. I talked to my surgeon. I finished up studying, came home. Then I had surgery to treat the stricture. So they basically more aggressively cut out the stricture. And my surgeon told me there was a chance that wouldn't work, but it was most likely that would be the cure. I did that, and then I took step one. Shortly after that, the stricture came back again, and I had sepsis again. I'd been on antibiotics prophylactically, so I wouldn't have sepsis. So this time, I didn't have bacterial sepsis like I had before. I had fungemia, fungus in your blood. It turns out that's way worse. And I didn't have the good candida. There's apparently a good candida and a bad candida to have in your blood. I had the bad candida, obviously. I was irrationally concerned about missing school. So I had a percutaneous nephrostomy tube in before this. After the fungus, I had percutaneous nephrostomy tube in instead of a stent. So it's just like a tube outside. I was irrationally worried about missing school. So I did part of my family med rotation, my first rotation, with the nephrostomy bag and a fanny pack under my white coat. And all the patients were like, I'm in so much pain. I'm like, me too. I had the curative surgery. I'm fine now. It was a robotic ureter reconstruction with buccal mucosa graft, which is just fancy words for they remade the ureter because I had messed it up so badly, and they used some tissue from the inside of my cheek. But all is well now. I can't say I've ever done anything halfway, not even sickness. I had every complication in addition to the strictures. Not only did I have the bacteremia, the fungemia, I had transaminitis from the antibiotics. I had red man syndrome from vancomycin infused too quickly. Apparently that's a real thing. That was a fun surprise. I had the pulmonary edema, so I couldn't breathe. Everything went wrong. Spending any significant amount of time in the hospital as a patient gives you an appreciation for how absurd the hospital is. It's dirty, it's loud, it's endlessly understaffed. The hospital is not where you want to be when you're sick, but then again, it's where you have to be. You can't sleep in the hospital. Anytime we round now on rotations, we ask the patient how they slept, and they say good. That's a lie. They did not sleep good. You're being woken up every few hours for vitals. Your roommate always had some sort of antics that's keeping you up. There's about 5 things that are beeping at all times. And it's, when people say they slept, I always say, I'm not sure about that. At Robert Wood, at least, I can't attest to other places, but chest x-rays are done at 1 a.m. exclusively. That's when they come. Blood work is done at 5 a.m. Vitals is anytime they think you might be sleeping, they'll come in. The nurse will give you a button and says, press this, but you have no idea when if you press it, they could come immediately or they could come an hour later. It's variable and you never know. It's the same button for if your phone charger fell, your bladder feels like it's going to explode, you're sobbing in pain, your neighbor asks you to press the button because maybe if they're both going off, someone will come. And I press my button for all of those things. And let me tell you, after you press your button for someone else, the nurses stop coming. They did not like that. They say you can leave any time, but can you really? Does insurance pay if you leave against medical advice? Something I actually really did think about. In the hospital, I had 2 blood samples that were lost and a urine sample that were lost. They would say, oh, it didn't make it to the lab. And the first person that told me that said it so casually, oh, it got lost. Where does it go? I don't understand how you lost it. I don't understand how you can't find it. And you have to stick me again. I had a cooling blanket that was essentially a weighted water blanket that was just like tepid warm water that they couldn't figure out how to work. So not only am I so uncomfortable, fever's up to 104, but now I have a room temperature weighted blanket on that no one can figure out how to use. I had a nasal cannula where the humidifier, the water ran out for it, so it gets really dry. That also sucks. all of this to say, when patients are frustrated in the hospital, I want you to think about this and understand. They're not just being annoying. The hospital sucks. Rounds are equally absurd. They were simultaneously the highlight of my day and the bane of my existence. They're the one time that someone comes to give you information. It's your time to get any questions answered. But they also come in at like 5 a.m. Imagine you're asleep, you're probably on some sort of drugs. Again, you don't really sleep in the hospital, so you just maybe dozed off. Someone comes in to wake you up, and by the time that you're like making sure you're covered with the gown, putting up the head of the bed, opening up your eyes, they had already given you the information for the day in that like 30 seconds. So also when you're in the hospital, I never had any idea of who these people were. I had like 20 doctors taking care of me at all times, and I know maybe one of them. It was a lot of people that would come in and assume that I knew who they were, and I was like, I have no idea who you are. And when they would tell me things in the morning, sometimes I wasn't even sure if my treatment team had come during rounds. Like, that's how out of it I was. I couldn't even remember if they had come to talk to me, nonetheless, what they had said. So if it's anything important, write it down. Or wait till visiting hours when their friends or family can take notes. Doctors would come in to see me, especially the ones that had come in all day, thinking I knew who they were. And I always felt bad, but I didn't know who they were, like I said, but I also didn't know what team they were on. I had infectious disease doctors. I had my internal medicine primary team. I had the urologist. I had the pulmonologist eventually, and then there's a different team for the ICU and the MICU and all of that. So what I would say to you all is to introduce yourself when you go into a patient room. And also say your role. So now I know that MTS means Medical Teaching Service, but I had no idea what that meant. And whenever I would complain about pain, and the nurses would appease me by saying they'd call MTS, I would just think, I don't know who this MTS person is, but I hope they're coming soon, and I hope they bring Dilaudid. Looking back on the whirlwind of people and places, it's truly the little things that made the biggest difference. I had a couple physicians, including my surgeon, who sat down while I was in the hospital. I was lying in bed and he was sitting on the chair. And even if they spent the same amount of time with me as if they were standing up, something about sitting down makes you feel heard, makes the patient feel like you could spend all day with them, even though, as we all know, that's not the case. But giving the illusion that you have time for them, that you're here to hear them, made the biggest difference. One of the doctors in the ICU sat down on the edge of my bed when I was sitting in the chair, and she just looked at me and said, "You will survive this." I'll never forget that. And being on rotations now, I can see why people don't. Even when I walk into the rooms, I'm like, oh, is that weird? Would that be invading their space? I mean, don't go crazy. Ask the patient if it's okay. But at least from my perspective, I never thought it was weird. I always thought it was nice, but don't forget to ask. My surgeon and his team were the only people who stayed constant. Seeing a familiar face made all the difference. The same resident that rushed me down to the OR my very first day stopped by on the day of my last surgery, to say good luck. He said, "I'm not on the service anymore, but I just wanted to wish you good luck and say that so-and-so, the new resident, you'll be in good hands." I thought that took him like 40 seconds. It probably meant nothing to him, but just having a familiar face say that I was going to be okay and I was in good hands made all the difference. I don't mean to talk a lot of shit about the hospital, but I really had a great surgeon, and that's what got me through staying at the hospital and going through all these surgeries, and I'm well. But I had a surgeon that would text me. And after my surgery, he would text me, "How's it going?" And then he sent me this GIF, this man is like, it was funny. I'm not going to say his age. I felt most scared, not when I was most sick, but when I felt forgotten about. It wasn't when I was crashing in the ICU. It was when I was doing better on the floors, but no one had come to see me, and I was convinced I was, again, forgotten about. That's the times that it's most scary and you think that you are going to be sick because no one cares, no one's looking out for you. How many times have you heard the patient say, nobody's telling us anything? That's a common thing in the hospital for patients or their families to say. I can tell you now that I can see it from both sides. As a patient, if you didn't come to see me, I'm convinced that you forgot about me. There's no other reason that I could think of. But now being on rotations, you could have called up the pharmacy to fix the dosing of my antifungals. You could have looked up primary literature, rounded for an hour, did table rounds, talked to my consult team, all of that. But if you didn't come in to see me, how would I know any of that? Next time you see patients, I want you to set expectations for when you're going to see them next. That's what builds trust. The only other thing that would erode my trust more than anything else was when the doctors would come in and tell me that my lab results weren't back yet. I had my friends bring my iPad to the hospital for me, so I would forget Instagram. I checked my chart religiously. I knew my results quicker than anybody else, so I'd always have them pulled up on my iPad, and when they came in and said, oh, your liver labs aren't back yet, I'd be like, yes, they are. We all have Epic on our phones now, so check Epic on your phone before you go in, even during rounds, especially for the medical students. If the attending's not that savvy or they're busy doing other things, you can easily pull it up. Because when they come in to visit you for that one time of the day and they don't know the one thing that you were waiting for, that's pretty distressing for the patient. So when patients are frustrated with the hospital and begging to be discharged or threatening to leave against medical advice, ask and wonder why. Think about this experience that I had and try to imagine yourself in these shoes. Be patient. I both begged and threatened. These are just a few stories of so many, but I hope they serve as a reminder of what a patient in the hospital is going through. As medical students, we spend years and literally hundreds of thousands of dollars learning how to take care of patients. But making patients feel taken care of, that's another story entirely. I hope that through my stories, I can share with you some of the tips on how to make patients feel more taken care of without having to have septic shock to learn it. 1, introduce yourself. Even if you've been there every day that week, if the patient didn't greet you by name, say who you are and what team you're with. 2, sit down. It's not weird, but again, ask. 3, earn their trust. Make sure you look up their labs, know their information, and update them often. And 4, be patient. If you were held hostage in the hospital, you'd want to leave too. Thank you.